माझं नाव अनुश्री आहे आणि हा सुशांत माझा नवरा. फ्रायडेला म्हणजे 5 तारीखला 5 एप्रिलला त्याला पीठ आली होती. त्याला आम्ही हॉस्पिटलमध्ये आणली ईगल्स मध्ये. 3 मिनिटं त्याचं म्हणजे तो जगात नव्हता ह्या. आणि तो जेव्हा ऍडमिट झाला तेव्हा डॉक्टरनी आम्हाला तेच सांगितलं होतं की 3 मिनिट तुम्ही लेट झालात करून. पण डॉक्टरनी जराही 1 सेकंड पण वेळ न घालवता त्यांनी ट्रीटमेंट चालू केल्या. त्याला CPR दिला. त्याला 40 मिनिटं CPR चालू होतं आणि त्यानंतर त्याला इंजेक्शन दिलं. तेव्हाही त्यांनी रिस्पॉन्स दिला नव्हता. त्याला 1 तासानंतर त्याची म्हणजे त्याच्यात थोडं एक करून 1% त्याचं हार्ट चालू झालं. ब्रेन तर त्याचं 2 दिवस पूर्ण म्हणजे ह्याच्यावर त्यांनी खूप चांगली ट्रीटमेंट दिली. या हॉस्पिटल म्हणजे हे हॉस्पिटल बेस्ट आहे मी बोलेन, कारण तो आम्हाला खरंच विश्वास नव्हता आणि डॉक्टरनी आम्हाला सांगितलं होतं की आता तुम्ही फक्त हात जोडून बसा, देव इथून वाचवू शकतो. पण जे प्रवीण कुलकर्णींनी केलं आणि हरीशने केलं, डॉक्टर हरीशने केलं, खूप आमच्यासाठी हे होतं. म्हणजे
देवाच्या कृपेने म्हणजे तेच आमच्यासाठी आले होते इकडे या हॉस्पिटलमध्ये आणि त्यांच्यामुळे आज मी परत माझे सेकंड लाईफ जगतोय असं मला वाटतंय सध्या तर. सो स्पेशली थँक्स टू डॉक्टर हरीश आणि डॉक्टर कुलकर्णी.
थँक्स टू ग्लेनगल्स हॉस्पिटल आणि दिस इज द बेस्ट हॉस्पिटल इन मुंबई.
याचा सपोर्ट स्टाफ पण त्यांचे खूप चांगले. त्यांनी बाकी नंतर मला जे ट्रीटमेंटसाठी किंवा बाकीच्या गोष्टींसाठी जे हेल्प केली त्यासाठी पण त्यांचे आभार.
थँक्यू.
Out of hospital cardiac arrest means the patient's heart has gone into a sudden standstill. After a patient collapses because of a cardiac arrest, there is a 2 to 3 minutes or a 5-minute window where we, if identified, these patients can be given cardiac resuscitation or what we call as CPR, and they can be revived. So in layman's term, this is like literally pulling out a patient from the death trap. Young gentleman who had presented to us came in an arrested state. So practically there was no heart beating when he came to the hospital. But because he came in time, because we had a equipped CPR team, which is called a code blue team, we were able to revive him with almost 40 minutes of CPR, where we gave certain clot breaking agents, and the patient today stands an absolutely intact heart with no permanent damage done. So this highlights the need of identifying cardiac arrest, identifying them and taking to an equipped hospital in time, where a timely intervention and CPR can save life.
Cardiac arrest मतलब हार्ट पूरी तरह बंद हो जाना. This cardiac arrest situation has become very common, particularly I would say post-COVID era. We are getting a lot of young patients, lot of patients who are coming to completely heart getting stopped and then coming to the casualty with no pulse and no BP. That means the pump of the body has stopped giving circulation to other organs, and then eventually other organs suffer and whole system collapses. This patient also had the same cardiac arrest, but it was out of the hospital. That is, it had happened in a unmonitored situation where he was not in the hospital. So this patient was brought almost 15-20 minutes on the way where the heart was not functioning. If somebody's heart is and pump is not functioning, the blood supply to vital organs of the body like brain, lungs, kidneys and heart itself gets compromised. What happens with this basically, every organ functioning requires oxygen, and that is supplied by the heart by pumping the blood. Once oxygen goes down, the heart stops beating. So this patient, when he was brought to our ER emergency room, he was not having any pulse, no blood pressure, he was not responsive, and we have a very active code blue team stationed 24/7 in the hospital. Once such patient is received in the department of ER, the code blue is announced. When the code blue is announced, our team comes within a minute to the situation and we start CPR. CPR is basically cardiopulmonary resuscitation. Like, we are trying to restart this stopped heart by giving artificial thumping and artificial compressions. Chest compression is what is very, very important. Inside timely chest compression, uninterrupted chest compression is very, very important. That is what we did in this patient. But to our surprise, even after 20-25 minutes of cardiopulmonary resuscitation by pumping his chest, his heart was not getting this. So the thought process, definitely there are common causes which we call 6H and 6T, where if you rule out all these causes, you will come to know what is the cause of this cardiac arrest. In this patient, we thought that thrombosis, basically T is for thrombosis. The vessel in the heart which supplies blood has been thrombosed because of some clot in the body. So we gave a clot bursting injection, and after giving this injection, we continued the CPR, which is supposed to be continued for 1.5 hours after giving this clot bursting injection. To our surprise, within 10 minutes, the rhythm started coming and the patient responded well to the treatment that we gave. So timely timely identifying what has happened to the patient, timely identifying what is the cause for the cardiac arrest can definitely give better outcomes. I think if this patient had not reached us within time, still it was very late for him to come, but still timely CPR, quality CPR, uninterrupted CPR, cardiopulmonary resuscitation is what is important. And I think that has given a good response in this patient. And word of caution to everyone who is young and who is having many medical issues in the past, they should do a regular health checkup and they should report to the doctors as and when required, so that this emergency situation should not come and somebody should not suffer out.
I was a part of the advanced cardiac life support team which helped salvage Sushant Ankola's life. The young gentleman came in a cardiac arrest situation to us with nearly 3 or 4 minutes of unresponsiveness before he came to the emergency room. In spite of the best efforts of ours, his heart would recurrently sink. Only after discussing with an able guidance of Dr. Praveen Kulkarni, who is the director of critical care, we could immediately go ahead thrombolizing this patient. This intervention, I believe, was the most critical in salvaging this young life with over 40 minutes of the resuscitation. And we are so glad that Sushant is now back to the society and the community and to his family. More so, I would like to reiterate the importance of an early recognition of the cardiac arrest in the community, which American Heart Association always emphasizes about, and the early chest compressions and calling for help. Also, I'd like to make a point at this moment about the importance of early recognition of the cardiac illness in the community. Risk factors for this, including the diabetes, family or the hereditary history for it, and the vices associated like smoking, etc. And an important of a regular health checkup for someone who is above age of 40 or maybe even the younger population with a strong cardiac history.